Welcome. Let's read the text, Paying Patients for Their Tissue, The Legacy of Henrietta Lacks, by Robert Trong, Aaron Kesselman, and Stephen Schaff. In The Immortal Life of Henrietta Lacks, Rebecca Skloot tells the moving story of a woman who was the source of the first immortal cell line, HeLa. The cells were obtained at Johns Hopkins University in 1951 from biopsies performed during her treatment for cervical cancer. Her physicians did not seek her consent before using her tissue for research, nor did they receive any personal financial gain from the cell line. The cell line did become extremely lucrative, however. Although it is difficult to precisely quantify the total revenue generated from the HeLa line, it is not unreasonable to assume that the line has contributed to hundreds of millions of dollars in downstream revenue. Hundreds of patents contain the word HeLa in their claims, and genetically modified versions of the line currently sell for as much as $10,000. For many, it seems an injustice that the Lacks family never received any financial benefit from the HeLa line, especially given that they lived in poverty, unable to pay even for their own medical care. Christoph Langauer, a cancer drug developer and former Hopkins faculty member, articulated this sense of inequity when he reportedly told Lacks's daughter that he thought the Hopkins had screwed up by not sharing some of their proceeds from the HeLa cell line with the Lacks family. Although this sentiment resonates with a sense of fairness for many people, it requires critical examination before becoming accepted as precedents regarding payments for patients. We recently had the opportunity to consider issues surrounding sharing revenues with patients who provide tissue for research when a young man, we will call him DF, was treated at the Dana-Farber Cancer Institute for a, top of the page, rare metastatic malignancy. Shortly before he died, he was admitted to the hospital with increasing shortness of breath, requiring placement of a pleural drainage catheter. With his knowledge and permission, the physician investigators obtained discarded fluid from the catheter to obtain and isolate tumor cells. The cells were processed into a cell line that holds promise for basic science research and the development of therapeutics. The line may result in a revenue stream for a medical center, as well as personal income for the physician investigators. After the patient died, the physician investigators who cared for him were motivated to see that his family received some financial benefit from his contribution. They sought advice from the Research Ethical Consultation Service at the Harvard Clinical and Translational Science Center, on which we serve. Property in human tissue. If patients own their tissues, even after its removal from their bodies, then it follows they have the right to demand payment when a profitable discovery derives from them. One of the earliest cases addressing this question was Moore versus Regents of the University of California. John Moore had his spleen removed as part of his treatment for a hairy cell leukemia. Several years later, he initiated a lawsuit after learning that his physician at the University of California, Los Angeles, had developed a lucrative cell line, MO, from this tissue. At the time, Moore predicted a market value of around $3 billion. In 1990, the California Supreme Court decided that Moore did not have a property interest in his removed cells, worrying that giving property rights to patients would hinder research by restricting access to the necessary raw materials and might destroy the economic incentive to conduct important medical research. Most other legal precedent supports the view that patients do not maintain a property invested in discarded tissue. Even if patients lack such property rights, there are many examples of individuals receiving financial compensation for donating tissue. A striking case was that of Ted Slavin, a man with hemophilia who developed extremely high antibody titers after contracting hepatitis B. When his physician informed him that his blood might be valuable to medical researchers, he was able to sell his serum for as much as $10,000 per liter, providing himself with a source of income for the rest of his life. Are more or slabbing cases relevant to those of lax and DF? What are the salient features that should determine whether patients should be paid for their tissue? We'll stop here, and the next video we'll read the rest of the article with you. Thanks!